Bismillahirrahmanirrahim. If you cannot do great things, do small things in a great way. Today, my topic of presentation is hepatitis B. The learning outline of my presentation is history, epidemiological triad, level of prevention, co-infection, hepatitis B and HIV, hepatitis B and pregnancy, global trends. The learning in the end of the session, the students will be able to understand the concept of hepatitis B infection, level of prevention, global trends, and vaccination coverage. First, we discuss the history of hepatitis B. It was an ancient disease. Earliest recognized blood-borne outbreak of hepatitis, Germany in 1883. In 1947, McCallum and Boer introduced the term hepatitis A for infectious and hepatitis B for serum hepatitis. Then this terminology was adopted by WHO in 1974. In 1965, Bort Samuel Bloomberg discovered hepatitis B surface antigen, which is one of the important serological markers. In 1970, Jane Cameron and Briggs visualized the hepatitis B virion Dane particle. Incidence. What is the incidence of hepatitis B? More than 1/3 of world population has been infected with this disease. It is highly endemic. Areas include China and Southeast Asia, where chronic infection rate ranges from 8% to 10%. Worldwide, the burden of this disease is estimated as 2 billion people have been infected and approximately 350 million people living with chronic hepatitis B virus infection. Now we discuss about the epidemiological triad. There are 3 factors in epidemiological triad: agent factor, host factor, and environment factor. In agent factor, hepatitis B virus is a complex 42 nanometer double-shelled DNA virus, and it replicates in the liver cell. There are 3 important serological markers. Number 1 is hepatitis B surface antigen, hepatitis B E antigen, and hepatitis B core antigen. Surface antigen is that antigen which is detected in their earlier stages, like in incubation period or in prodromal phase. This marker show the virus replication and the status of infectivity. And core antigen also tells about the current status of the disease. And when the liver disease is settled down, then the antibodies of these markers are produced. This is the picture of hepatitis B virus. In host factor, all ages are susceptible and highest prevalence found in the age between 20 to 40 years. The disease is equal in both gender, and the high risk group include recipient of blood transfusion, surgeon, healthcare worker, laboratory personnel, homosexual, and percutaneous drug abuser. These are the group of high risk people. In environment factor, the cases of this disease is present in the whole years and all the season. And the disease is more spread in the poor and illiterate people. Chain of transmission. In chain of transmission, we discuss the reservoir and infective material. The reservoir of this disease is the cases and the carrier of the disease. Who are the carriers of this disease? The people of which have the surface antigen more than 9 months period, then we say that the person is the carrier of this disease. And infective material is the contaminated blood and the body secretions like saliva, semen, blood, and urine. What is the concentration of hepatitis B virus in various body fluids? The highest concentration of hepatitis B virus in the blood, serum, and bound exudate, moderate concentration in semen, vaginal fluid, and saliva, and low amount is found in urine, feces, sweat, tears, and breast milk. How this disease is spread? There are a main three modes of transmission of this disease: parenteral route, vertical transmission, and sexual transmission. Parenteral route: infected blood and blood products, contaminated syringes, pricks of skin, dental procedure, tattooing, and piercing is the main mode of transmission of this disease. Infectivity period. The incubation period of this disease is prolonged, almost 45 to 100 days, and the period of communicability is also a several months, and it's depend upon the presence or absence of a surface antigen. Clinical features of this disease is divided into two states, whether it is acute hepatitis or a chronic hepatitis. In acute hepatitis, the sign and symptom in which the patient present in OPD are fever, nausea, vomiting, jaundice, and anorexia. And these acute condition, when they are progressed, then there is a chronic hepatitis, and progression to chronicity is as high in children or adults. And the most cases of chronic hepatitis B occur in those individuals who had never episode of acute viral hepatitis. And in the chronic hepatitis, there is a progression of sign and symptom like anorexia, weight loss, and fatigue. These are the symptoms of hepatitis B: encephalopathy, jaundice, itching of skin, bleeding from the esophagus and stomach, edema, violation of blood clotting, Palmer erythema, development of ascites. Outcome of hepatitis B infection. Acute infection. When there is acute infection of hepatitis B, then it proceeds into a different stages like subclinical form, a healthy carrier, persistent infection, or a chronic state. And then these are the outcome which we discover after a many years, either a recovery of the patient or there is a development of fulminant hepatitis, and from the chronic state, either the development of cirrhosis or hepatocellular carcinoma or the recovery of patient. Complication. The complication of hepatitis, the main complication of hepatitis is fulminant hepatitis, hospitalization of a patient due to ascites, cirrhosis, hepatocellular carcinoma, fibrosis, and death. Now we move towards the level of prevention. There are mainly three levels of prevention: primary, secondary, and tertiary. In primary level of prevention, first we know about the health promotion. And in the health promotion of hepatitis B, the 28th July is a celebrated as a World Hepatitis Day for the awareness of hepatitis B disease. And in the health promotion, we educate the people about safe blood transfusion and avoid the use of contaminated syringes, sterile equipment used during the surgical procedure. And in the specific protection, there is a vaccination, and there are two type of immunization: active immunization and a passive immunization. In active immunization, we can use a vaccine, which is plasma-derived vaccine or a recombinant DNA vaccine. And in a passive immunization, we can give immunoglobulins to the patient who are exposed to the hepatitis B positive patient. It is used as a prophylactic. What about plasma-derived vaccine? It is basically based on surface antigen derived from plasma of human carrier, and it is a formalin inactivated in this vaccine. And then it comes a recombinant DNA vaccine. It is introduced in 1986 in USA, and it is a successfully replaced the plasma-derived vaccine. The main It is This vaccine is a cost effective and it is available as monovalent or a combined form. The active substance of this vaccine is again the surface antigen. Adjuvant which is used is alum or thimerosal, and the storage temperature of this vaccine is 2 to 8 degrees centigrade, and avoid the freezing of this vaccine. And what we done in passive immunization? In passive immunization, we can give combined active and passive immunization, which is advised in following cases. Newborn of hepatitis B positive mother, if there is a percutaneous exposure, sexual exposure, and recurrent hepatitis B virus infection. The time in which we give the passive immunization to the patient is 6 hours or a maximum 48 hours, and the dose is 0.05 to 0.07 ml per kg body weight. In hepatitis B, we can combinedly use the active and passive immunization. This is the EPI schedule which is followed in Pakistan, and the hepatitis B vaccination is used as a pentavalent form, and it administered the child in the week of 6 weeks, 10 weeks, and 14 weeks, along with the DPT and Haemophilus influenza. In pentavalent vaccine, DPT, hepatitis B, and Haemophilus influenza vaccine is used. What is the global coverage of the hepatitis B vaccination? The global immunization from 19, this graph will show the global coverage of the vaccination in from 1989 to 2019. And regarding the hepatitis B, the global coverage is increased almost 85% in from 2019 in all worldwide. In secondary level of prevention, we can early diagnose the disease and a prompt treatment. And for the early diagnosis, we can use different laboratory investigation, raised level of AST and ALT, raised level of serum bilirubin, serological marker, which is the important diagnostic tool for the for checking the status of hepatitis B, and measure a prothrombin time. If the prothrombin time is increased, then it is the worst prognosis of this disease. These are the serological marker, and these are the different state in which they show a different result. Like in past infection, you can see that the core antigen antibody is positive. And in acute infection, IgM is positive and surface antigen is positive. And in chronic infection, surface antigen and IgG is positive. This is the again serological marker in a diagrammatic representation, and you can see that in the recovery phases, the serological marker which are seen, these are the anti-hepatitis B core antigen and anti-hepatitis B surface antigen. These are present in the recovery phase. And in the secondary level of prevention, there is also include the prompt treatment. And for the prompt treatment, we can use immunomodulatory therapies in which conventional interferon alpha is used, nucleoside and nucleotide analogs are used, lamivudine, anti-caver, adifovir, and tenofovir are used for the treatment of hepatitis B virus infection. When we say that the patient is in inactive carrier state, when there is the absence of HBE antigen, which basically show the level of infectivity or a replication of virus in the patient, and the presence of this anti-HBe antigen, low level of hepatitis B virus DNA, and there is a normal ALT level and slight fibrosis are seen on the ultrasound. What is the status of hepatitis B in pregnancy? There is a risk of transmission increase from 10% to 90% from first trimester to third trimester. If mother is positive, the newborn must be given first dose of vaccination and immunoglobulin. According to WHO, it is safe to breastfeed the newborn. What about hepatitis B and hepatitis HIV? These are the co-infection and it may be present together in a same individual. 10% of 40 million people infected with HIV are co-infected with hepatitis B virus. Hepatitis B virus infection has minimal progression of HIV, but HIV markedly increase the risk of developing cirrhosis and hepatocellular carcinoma. What is the treatment of this co-infection? Tenofovir or a combination of tenofovir and M-triacetabine are approved therapies for HIV and hepatitis B virus co-infected person. What about the global progression on the elimination of a viral hepatitis? In 2017, the WHO said that the viral hepatitis is a major threat in the coming years, and they establish a plan for the elimination of this disease. In 2016, the WHO passed a resolution to eliminate viral hepatitis as a public health threat by 2030. And they say that in 2017, the WHO asked the Minister of Health in all 194 member states to complete a country profile on viral hepatitis about the and then make a policy about the funds or a national plan, engagement of civil society and testing guidance. And the results of this come is 194 member state in which 135 respond accounting for 87% of the global population infected with hepatitis B virus. And they developed and all members are agreed to develop a national plan for the elimination of this disease. These are the graphic representation in which they are um, they are home to 87% of the infected people, 62% had a national viral hepatitis plan, and 36% had assigned dedicated funding for implementation. This varied by whether or not government engagement with a civil society. This is a picture of global vaccination coverage in 2019. All the diseases which are prevented by a vaccination, and you can see that the hepatitis B vaccination coverage through worldwide is almost 85%. It is followed almost in all countries, and there is a great achievement in the coverage of the vaccination of infant or child. These are the references of my presentation. Now it's time for the MCQs. Which of the following statement is not true about hepatitis B virus? Can be grown on monkey cell line, known as a Dane particle. HBe antigen indicates viral replication and infectivity, can survive for prolonged period outside the body. Best epidemiological tool for investigation of hepatitis B is B, core antigen. A mother is hepatitis B surface antigen positive at 32 weeks of pregnancy. What should be given to the newborn to prevent neonatal
C.
infection?
C.
Right,
C.
C.
right, right answer C. In acute hepatitis B infection, the earliest abnormality detected is
B.
Hepatitis B surface
B.
antigen.
B. Surface
B.
antigen.
surface antigen A. All of the following are true regarding hepatitis B vaccine except highly purified recombinant DNA vaccine
C.
should be stored.
C.
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 Right
Accident is
answer.
frozen.
Passive immunization is strongly recommended in case of exposure with.
B.
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 Right answer. All of the following are type of RNA virus
Hepatitis B.
except.
B.
B.
Yes,
B.
hepatitis B is a DNA virus. According to UNICEF, the vaccination coverage of hepatitis
C.
B.
85%.
C.
C. C.
Right answer. Highest concentration of hepatitis
Blood.
B
A.
found.
Blood.
A.
A.
World Hepatitis Day celebrated.
28 July.
D. 28 July.
This is the key of the MCQs. And thank you.
Well done. Thank you very much. Please announce the result.
Ma'am, Maida, Dr. Sadia, Dr. Marine, Dr. Khansa, Dr. Daud.
Okay, well done. They have performed very well. I am so happy that all the students they are contributing towards their professional development and learning. I am very happy with the participation of all the students. Now, Dr. Naila, my question is about, as you have said, that in secondary prevention, we have to go for early diagnosis and prompt treatment. Now, the concern is that hepatitis B virus mutations, they are causing a lot of disease burden and their detection, it is always a challenging thing. So how would you suggest that according to the secondary prevention, the mutations should be addressed?
It is difficult to address the mutation because when sign and symptom develop, then we perform a different lab test and then we find out the mutations.
What are those lab tests that you have mentioned they can be used to detect the mutations?
Ma'am, these lab tests, mainly the serological markers which are used.
Please mention the name of those tests that are being used for detection of mutation. And let me remind you one thing, that the hepatitis B is one of the most important public health disease. And being an examiner myself for the past 12 to 15 years in different courses, including undergraduate examinations and postgraduate examinations, including MPhil, MD, FCPS, etc. What I have seen is that hepatitis B, it seems a quite common and a very prevalent disease in our community. However, whenever there is an examination, I have seen the students are not very well prepared about the different aspects of this disease. As you all know that before 2002, we don't have even routine vaccination of hepatitis B. Later on, it was introduced, and we have now the hepatitis B vaccine that is available as a routine immunization. There are many aspects that still need further discussion, like mutations. What is the different tests that should be used to detect the mutations? And one of them is PCR test. We can have, as this is a DNA virus, so the PCR test can help us in finding out the mutations. Number second, the very important thing is about the replication of the virus, because increased replication shows that activity of the disease and severity of the disease that is correlated with the replication of the disease. And I have this question from the whole class. What would be the test for looking at the replication of the disease?
Hepatitis B E antigen.
E antigen. HB.
Very nice. It is hepatitis B E antigen that is used for looking at the replication Okay, now my next question is about the different tests like screening tests that are being used for hepatitis B infection.
Couldn't hear.
सॉरी मैम आवाज नहीं आई
Without
Ma'am,
G, please. I am asking about the rapid testing or screening testing that is being used for hepatitis B.
Surface antigen.
ELISA, IgM and IgG antibodies.
May I repeat my question?
There's some distortion in the sound.
Madam,
Ma'am,
May I
ELISA
repeat
test?
my question?
yes, ma'am.
My question is that screening tests that are being used for hepatitis B, how they are compared in sensitivity and specificity with the other diagnostic tests. I have reframed my question. Perhaps that would lead to the correct answer.
No idea, ma'am. ELISA, IgM or IgG?
How ELISA, PCR, and the rapid testing that is being used for hepatitis B that is helping us in finding out the number of the cases. As we know, the screening test should be cost effective, it should be rapidly done, it should be acceptable to the population. So what are those screening tests?
That's for surface antigen.
Okay, everybody, please let me know. We know that there are many tests, like we have the rapid test that even can be cost effective. It is very appropriate to use at a very large population. However, we have the issue with the sensitivity and specificity of these tests. They are cost effective. They are so cheap that even in 50 rupees, one can get a test for hepatitis B. And the surface antigen, which is basically based on hepatitis B surface antigen, the main issue is with its sensitivity and specificity. We all know that whenever we do any PCR test, it has a very high sensitivity and specificity, but its cost is large. Cost is large, and so we have an issue in offering it to the community or population. Whenever we do the screening test, all those who are positive, they have to be confirmed by PCR, right? Those who are positive on PCR, they are confirmatory for the disease. We have already discussed this point that whenever we are using any screening test, its sensitivity and specificity has to be compared with the gold standard, and the gold standard here is the PCR test. The second point that I want to emphasize here is you never ever prescribe any screening test in a community where the PCR situation is not there, or the facility for the PCR polymerase chain reaction is not being offered to that population, because all those who are having positive disease on screening test, they have to be confirmed on PCR. All those who have a very strong clinical picture of hepatitis infection, and they are having negative tests, they also have to go for PCR testing. So our secondary prevention level, with that says the early diagnosis and prompt treatment, it holds very true for hepatitis B infection. Whenever we go for a replication, we have to check for E antigen, and this E antigen shows that there is a very high levels of replication that are present. Second, we have talked about mutations. There are mutations that hepatitis B virus is notorious to have mutations, and again, the PCR is the early diagnostic criteria for picking those mutations and prescribing them the correct management. If you have any other question, you are most welcome to ask. I am happy that many recent advances has been covered. Yesterday, I have given my feedback to Dr. Sadia that the presentation should be covered in 30 minutes. And after 30 minutes, in the rest of the 10 minutes, we are having MCQs and the feedback session, and even discussions. And if you have any questions, you can ask it and even put in the chat box. Again, it is emphasized this time too that I have seen that within 20 minutes, Dr. Naila has completed her presentation, and she has more time, and she can even have more slides about a very important aspect about the mutation, and the second very important aspect about the screening test, and about the diagnostic test or confirmatory test, and how their sensitivity and specificity they should be related, and about the replication of hepatitis B virus. So I would request Dr. Naila to please add these slides in your presentation and then share it again with me.
Yes, ma'am, I
Thank
will
you.
add the slides.
If you have any questions, you do ask. Otherwise, it is a brilliant presentation. Allah Hafiz.
Thank you, ma'am.
I will have a face-to-face discussion with Dr. Naila today. Right. Allah Hafiz.